Welcome to the Inner Fire Climbing Podcast. I am Jesse Firestone. My guest today is Madeeha Drissi. I'll introduce her properly on the show, so no need to get into that here. And before we start the show, the only other thing I'll say is this podcast is supported by my patrons over on Patreon. So if you want to support the podcast, get other goodies over there on Patreon. I do technical breakdowns, and I'm starting to post more videos on there now because I have my board up and running in my garage, so it's a little easier for me to record. And patrons can also ask questions on my monthly AMA episodes. So you can go check that out at patreon.com/innerfireclimbing if you're so inclined. And let's get to the guest. All right, Madeeha Drissi, welcome to the podcast. We did it.
Yay, so happy to be here.
We got there. We're recording. Welcome to the show.
Thank you for having me.
Yeah, I was excited to have you on the show because you are a board certified dermatologist. Is that the correct?
Board certified. That is the full term.
Yeah, cool. So I just want to ask you a couple questions, kind of get to know you a little bit for the audience so that they kind of know who you are, what you're about. And then we're going to talk about skin in, I think, great detail, it seems like.
A lot of detail. Maybe
Awesome.
Not that much, but enough. Enough to walk away feeling happy, yeah.
So, okay, tell us who you are and where you're from and how long you've been climbing and all that stuff.
Yeah, my name is Madeeha Drissi. I've lived in Texas most of my life. Recently moved to Minnesota, but I started climbing about 4 years ago while I was doing residency for dermatology, and I've been pretty much consistently climbing ever since. Did my training down at Baylor Scott and White Hospital with a great group of people in Central Texas, and like I mentioned earlier, now I'm in Minnesota.
Cool. Yeah, and you're glazing over some of the impressiveness, I think, because you've been climbing 4 years, but you're a pretty strong climber. You're climbing some hard grades. I think you just came back from a trip. You were in 10 sleep, right?
On sleep, yeah, yeah. Didn't
Yeah.
climb anything super hard then, but right now I'm kind of, I guess last year was when I kind of first broke into 512, 512A, and kind of working more towards 512 plus right now, but I've just been
Cool.
climbing consistently, so of
Do you
course,
feel like your skin insider knowledge has helped you to climb harder grades faster?
I don't know because I feel like the whole time that I've been a climber, I've had like that insider knowledge for skin, so I haven't been there without that knowledge. So it's like what I know, it's
Mhm.
like I don't know if everyone knows this or not. But it's just like very basic stuff, It's not like they teach you anything super climbing specific in like, dermatology residency training
Totally.
where, yeah, but it's just like general concepts. My skin has usually not been an issue for me, so feel good about that, but sometimes it is. So, take a few steps back.
Yeah. Uh, Interesting. What is that? You kind of mentioned where you went to school, but what is that education actually like to become a dermatologist? I think it's like full blown doctor. It's like 12 years or something, right?
Yeah, yeah. So after undergrad, usually 4 years of college, it's like the whole 4 years of med school, and then derm residency it requires like one internal year, or sorry, one intern year in just internal medicine or surgery or something kind of equivalent to that. So one general medicine year, and then 3 years of derm residency. So that's 4 years after med school. And then if you want to do an additional fellowship, that could be another year or two potentially.
Wow. Okay. So it's like
Yeah.
it's a serious amount of school.
Yeah.
Yeah.
It's just kind of like the other specialties.
And I'm just a layman. I don't know what any of these things mean, but the board certified, that's like there's like an American board of dermatologists or something, and you have to pass some kind of
Yeah.
test. Is that what that is?
Yeah, the ABD, the American Board of Dermatology. So
Oh
once you
wow.
finish
I was right on.
residency, about it, yeah, once you finish residency, you take that exam and then study for a lot and then yeah, if you pass, good, yeah.
Okay, cool. All right, so I feel like we've established your qualifications a little bit, which is good. Um, so we're going to try to cover a lot of stuff. We're going to try to cover some general skin anatomy stuff and wound healing, and then we're going to try to get into some more nitty gritty climbing specific, maybe not climbing specific, but things that we feel apply a little bit more to climbing. and then have
Yeah,
some
for sure.
questions at the end. And we may bounce around a little bit depending. But I guess let's start with the sort of basic skin anatomy stuff. What is skin? Is that too general of a question?
That's such a good question. So yeah, and I won't get into like too nitty-gritty details because I feel like that's just not relevant to most people and climbers. But what is skin? Such a great question. So there are many layers to the skin. It's not just kind of, one big chunk. The topmost layer that we see when we kind of look down at our skin is the epidermis, and the epidermis itself has a couple layers. The top most layer of the epidermis is called the stratum corneum. So when you look down at your palms, that's what you're seeing, or the rest of your skin. And on the palms specifically, the stratum corneum is a lot thicker than the rest of your body. So the palms and the soles of the feet kind of have that thickest layer of skin, and that's what, helps us climb a little bit more without getting too beat up.
Mhm.
Um, Other layers on the epidermis include the stratum lucidum, the stratum granulosum, stratum spinosum, the stratum basale, but a little bit less relevant to know, I think, compared to just the corneum. When you get like a flapper or a tear or a cut, on your skin, you kind of see that little like pinkish flesh, a little bit deeper, maybe a little bit of blood. Probably at that point, you're getting more into that second layer of skin, the dermis, basically. So
Okay.
the epidermis is up on top, and then the dermis is right below it. And then below the dermis, you've got the subcutaneous space. That's kind of where the fat is. But generally, most cuts that you're getting and most flappers you're getting aren't going that deep.
Yeah, we shouldn't be seeing those layers in daily
Yeah.
climbing practice. Yeah.
Typically not. The dermis that has most of like the vasculature, the blood supply, the nutrients, and the epidermis itself doesn't have that vasculature and the blood supply. So
Gotcha.
all of its nutrients the epidermis gets from that deeper layer of skin, the dermis.
Okay. Yeah, so okay, this is like my first I'm a dummy who doesn't know anything about how the body actually works question, but it feels to me like as my skin wears down and it gets more pink, my
Yeah.
that's you're saying that's because there's like more blood flow at those lower layers basically. So it literally is like
Yeah.
pink because there's more blood in it. Okay.
I yeah, that's what I think so. Yeah. Or
Okay.
part of it at least. Yeah.
That also kind of makes sense that like as you wear through your skin, it's probably a little bit moister in those lower layers. It's not as dried out from being like exposed to the air and stuff.
Yeah, yeah, totally. All of the moisture that the corneum and other layers of the epidermis, it gets from the dermis.
Gotcha. Okay.
Mhm.
How does sweat play into that? Because obviously there's blood flow, but then we also have sweat glands, and there seems to be like a pretty huge difference climber to climber in how much they actually sweat, like anywhere, but especially on the fingertips. Like my the story that this brings to mind is I had a client who like she just showed me with a paper towel on her desk, like she like dried her hand completely on a towel and then just like put her fingers on the paper towel, and the paper towel
Yeah.
was like soaked wet within like seconds. I think she had like
Yeah,
hyperhidrosis it's called.
hyperhidrosis. Yeah.
Whereas me, like I just that just wouldn't like nothing would happen if I put my hand in a paper towel. It just would remain
Yeah.
dry. So
Yeah, yeah. Great question. So the sweat ducts, they're located, in the dermis level and lower levels of the dermis. And then the ducts actually, that's kind of where the sweat glands originate from, but the ducts travel up into the epidermis and then out through the stratum corneum. So that's kind of how sweating happens.
okay,
Yeah, and then it's the sympathetic nervous system that's responsible for the sweating in our body. So like flight or flight mode. But as you kind of precluded to earlier, there is a condition called hyperhidrosis. Medically, hyperhidrosis can be primary hyperhidrosis, or secondary hyperhidrosis. And so primary, that's, if someone does have excessive sweating, most of the time it's primary. So this is kind of defined as sweating that is localized, usually to like the palms, the soles, underarms, specific areas of the body. And you have excessive sweating that, has nothing to do with temperature control or body regulation, things like that. And it's not due to any other reason. So generally, when people experience this, they have it from like, adolescence, early teenage years is when it develops. There may be like a hereditary component to it. Um, And then secondary hyperhidrosis is when you've got excessive sweating due to another reason, like you're taking medications or you've got some other medical condition that might be causing it. But most of the time when climbers, compare about sweaty tips or palms, they probably don't fit into like one of those medical categories of hyperhidrosis. Like,
Okay.
so they may not medically have it. It's not really getting in the way of their life outside of climbing. But you may still have, sweaty tips just a little bit more than the average person if you're a climber.
Yeah, is it one of those things where it's like on a spectrum basically from you're just not a sweaty person to you're a sweaty person, and like somewhere along there you can get diagnosed with hyperhidrosis, or is there like a test of some kind that they do?
Yeah, I think there's not specifically a test of some kind that we do to say like, oh, you have hyperhidrosis. It's more of like, kind of quality of life impact and if it's getting in the way of your day-to-day thing. So usually when people come to me for it, it's getting in the way of like a lot of things and
Gotcha.
they want to get treated for it. So
Is it I know I get that it's the nervous system that triggers it, and I don't even know if you know the answers to these questions. These are my this is me kind of trying to ask all the questions that I think anyone would ask, but is it like that person's sweat ducts are wider, or they just have more sweat going through them at any given time? Like, do we know what the mechanism is for that?
I don't actually know that off the top of my head. I don't think it's because there's any difference in their anatomy of sweat
Okay.
ducts. So I feel like I mean, I'm not 100%, but I don't recall that being like a factor, And then the treatments that, kind of target it usually have to do with, so it's acetylcholine that's released from like the sympathetic nerves, that triggers it. So most of the treatments that we have that are like either oral or like, for example, Botox injections, they target that acetylcholine release to keep it from happening. There's nothing I know that necessarily I mean, I guess you could say that some topicals may cause atrophy of the sweat ducts, that we use topically for hyperhidrosis. But
Hmm.
yeah, I don't think there's anything like I don't think if we took a biopsy of their skin under the microscope that their sweat ducts would be a lot larger than like the average person's.
Okay. Got
Yeah.
it. So it's probably more of just like a what's going on rather than a what their body is like kind of thing.
Yeah. Yeah.
Gotcha. Okay. Trying to think of anything else that we would maybe need to know about anatomy. So we kind of covered the epidermis and the dermis, those lower layers, and now I know that the everything originates from the lower layers and kind of goes up, and then that outer layer though it is alive, right? It is like a part of my body. I know people
Yeah.
talk about like dead skin falling off and stuff like that, but
Yeah.
it's still part of my body unless it's like white and flaking
For
off or something
sure.
like that, right? Yeah.
Yeah, for sure. For sure.
Okay.
It's that
So it
stratum corneum that's like that flaking off part. Yeah, that's pretty much dead keratinocytes.
got it. Okay.
Yeah.
Yeah. I guess that makes me want to ask a little bit about how it adapts and gets harder. And there's so many ways that I want to ask that question and talk about it. But maybe the place to start is just that I coach a lot of people who think that they have sweaty skin, and I've noticed that many of those people skew a little younger. And I also remember when I was climbing 17 years ago or whatever, I was convinced that I had super sweaty skin, which I don't think I do anymore. Um, and now my theory is kind of just that I was climbing a ton and I was always on those lower layers that are just more moist, basically, right? Because I was just wearing down the harder layer and I wasn't giving my body time to adapt to like have it be tougher. So
Mhm.
is that true? Like, does our skin get drier as we age, and does it get drier as we do sports like climbing more? Do you think that that's a real thing?
Yeah, I know our skin definitely does get drier as we age, so that is definitely a thing. But I don't know if like sports like climbing necessarily make our skin as a whole drier. Now, there is like definitely more wear and tear on the skin, and so like I don't know about you, but like after I climb, my skin definitely feels on the dry side of things. And so there's that like short term kind of aspect. But
Hmm.
I don't think long term, if we're a climber, that we're at higher risk of getting dry skin if we just appropriately care for it. Does that make sense?
It
Um,
does. I mean,
yeah,
and I have a hard time telling, like, after I have a hard climbing session and my skin feels really dried out, especially if it has, like, some little abrasions or, like, some
yeah,
areas where you, like, slipped off a hold and you just, maybe it's not even red, but you can tell, like, it's really sensitive in that spot. But I never
yeah,
know if it feels that way, if it feels dry and stuff in general because of the climbing or if it's from using all the chalk because
Yeah.
chalk is definitely a drying agent. I know
More dry.
I
Yeah.
don't want to jump too far ahead into all the drying agent stuff, but
Yeah.
those short-term adaptations, like they probably do come more from the actual abrasion than from anything that we're putting on our skin, right?
I think so. I feel like the short-term adaptations are probably coming from like like the, external pressures that we're putting on our skin. Maybe more so than just chalk. Yeah.
Hmm. And here's another one of my crackpot theories. This is great. This is like I tell you all my wackadoodle ideas I've come up with, and you validate me with your education. Um, I kind of feel like if you go too deep into your skin bank, and you're past that top layer, you're down into the pink like dermis layer. I sort of think that my skin, when I do that too much, my skin does not come back strong. It's like I'm not giving it a stimulus anymore. I'm just like traumatizing it, if
Yeah.
that makes sense.
I agree with you. I feel like it's kind of similar to like a muscle bank or like, like whatever your bank is for what your workout for the day. You don't want to like dig too deep into it. And I
Mm-hmm.
think ultimately it's like there's things that we can do to help with like the wound healing process and the skin healing process, but in the end it still needs time, and then the
Mm-hmm.
more you dig deeper into that hole, I mean the more time you're going to need to help heal it. So
Totally.
I agree with you on that. Yeah.
Is there anything, I'm not sure what you would draw from for this, but like, what do we know about how fast skin heals or how fast it adapts and those kind of things?
Yeah. So skin healing, like the entire epidermis, I think it depends on the person also. So like your age. So if you're older, it can take a little bit longer for it to completely turn over compared to like if you're younger. But generally like somewhere along like maybe 30 potentially to 40 days, the entire epidermis can regenerate itself depending on the area of the body, things like that. So it takes time. It takes time for
Mm-hmm.
that bottom layer of the epi to go all the way to the top. Um, and so in terms of I tried to look this up too, just like skin adaptations. I could not find like a single paper just kind of going over even different sports, like how your skin adapts to like the various stressors. Like how long does it take for a callus to form? How many
Mm-hmm.
sessions? How thick is that callus going to be? Couldn't find exact numbers, so details to scientifically answer that question. But I don't know, from experience, would you say like how many sessions? Is it just dependent on what you're climbing or the type of rock you're climbing on or what you're doing?
I think it must depend on that quite a lot. And
Yeah.
when I was younger, again, maybe 10 plus years ago, I felt like I needed a solid like week or more for my skin to really adapt. So if I was going on a 1 week trip, I felt like the weeks leading up to that trip, I needed to like really condition my skin so that it would be tough and dry. But
Okay.
now that maybe this is just because I'm older, or maybe it's something to do with the way I climb, because I think that's really important too. But now, like, I feel like I just need like a session or two, and my skin is like pretty tough again. But
Okay.
it's
Okay.
hard for me to tell how much of that is my perception versus
Yeah.
I'm just not like throwing myself towards sharp holds quite as much as I was 10 years ago. I'm a lot more like controlled and stable.
Yeah.
So
Yeah.
it's
Now,
really hard for me to tell.
yeah, do you still aim for your skin to be tough and dry? Is that like still something that you aim for? Like
Pretty
dry
much.
meaning like
Yeah.
not sweaty, and then what do you mean by tough? Like just like um not soft, not I
I
guess.
basically I want like as much suppleness or like
hmm
pliancy, is that a word? I want it to be like pliant and
Pliability. Yeah.
yeah,
Then you
like
want
yeah.
suppleness. Okay. It's not like
Yeah,
you're looking for like really calloused thick skin. Okay.
I want as much suppleness as I can get without feeling like I'm gonna get cut up. So if the
Okay.
sharper the rock is, the less
Yeah.
pliability I feel like I can afford. So if I was gonna go climb in
Okay.
like J tree or
Yeah.
something, like I actually would want my skin to be pretty tough and calloused, just because I feel like
Okay.
if it's very pliable
Really
there,
soft.
I just
Yeah.
get cut to shit. But
Gotcha.
this is what I found with dry skin is like it's a double-edged sword where if I
Right.
try to get it too toughened and calloused, then I wind up getting really bad splits. So it's like
Right.
it's a very fine line. And that's actually why I live in the Northwest and why I climb where I do, because like I'm going to go climb in the forest today, and
Yeah,
I just my skin can be as dry as I want, and if I'm climbing in a 60% humidity
right.
forest, like it's fine. I'm not
You're
ever going to
fine.
split. Yeah.
Yeah, compared to like if you're in the desert, then it's like, oh, yeah.
Yeah.
It's
And if
also
you're like
just painful. Yeah, I feel like to
totally,
have
and if
dry
you're like the
skin.
sweaty
Yeah.
archetype, then you definitely would want to like go to Bishop or Waco Tanks or something where it's going
Yeah.
to serve you a little bit better there, I think.
Yeah, yeah, for sure. I was just wondering because, like one thing I wanted to touch on, and we might do it later too, was just like the concept of wound healing. And so,
Yeah.
dry skin is not optimal for that to happen. So
Yeah.
if
Totally.
you're trying to keep your hands dry most of the time, may not be, the best way to take care of your skin after climbing.
Yeah, I think I've kind of landed on just a living here for sure, and anywhere if I'm not on a trip to a place that's like an extremely dry climate, I just have a
Yeah.
more low anxiety. Like I used to be the like don't go in the hot tub, don't take a hot shower if I'm on a climbing trip.
Oh
Like
yeah.
I would always
Yeah.
put on dish gloves to do the dishes, and now I'm just like I just do all that. I don't care. Like I'll get in the
Yeah.
hot tub and put my hand. I don't care. You know,
Yeah.
if
Yeah.
I'm in Waco tanks where I'm like at elevation and it's like 7% humidity or whatever, then I need to be a little bit more careful and use some moisturizer and stuff like that. But I just kind of come
Right.
up with strategies for each place I go.
Yeah.
On
Yeah.
the wound healing note though, I kind of feel like maybe that's the other thing about age that I haven't given myself enough credit for is like when I was younger, my skin did feel terrible, but also like I could just sleep one night, not even take a rest day. And like my skin would actually be like quite a bit better where that's not the
Yeah.
case anymore for sure. So
Yeah.
how does our skin heal and what do we do to make it heal faster?
Yeah, yeah. So, I think the optimal environment for wound healing is like a moist environment. And so you don't want to have dry, cracked skin. This is especially relevant if you like actually have flappers or cuts, things like that, that where there is an open wound. And so, generally what I just the most basic thing. So if you have like an open cut or tear, something as simple as just like Vaseline or Aquaphor and keeping it covered throughout the day is going to accelerate the wound healing a little bit more, or just help it to happen. That wound healing, that occlusion that you create when you put something on, like whether it's just a Band-Aid or just some Vaseline, Aquaphor, a little bit of climbing balm on top. What that does is it basically like it helps with the angiogenesis process from happening, especially if there is like a deeper wound or a cut, because
Hmm.
that occlusion helps the blood basically, but more blood vessels grow in that area.
Okay, too many syllables.
Yeah.
What's angiogenesis?
Angiogenesis is formation of new blood vessels.
Okay, okay. So
Yeah.
you did it.
Yeah.
You explained it. If I had been using my context clues, I would have gotten that.
Sorry, please interrupt me at any point. Yeah.
No, that's okay. So we want to keep it covered and moist if we want it to heal as fast as possible, basically.
Yes, and this is especially relevant, I think, if you do have like, cuts or tears or splits or flappers, things like that. But even if your hands are just like roughened up, like after a day of climbing, which
Hmm.
always is for me,
Hmm.
just after climbing, wash your hands, gently rinse, but then after that, pretty much immediately put on a little bit of moisturizer, if your hands are feeling dry at all, which I'm on the drier end, so I feel like every time my hands get in contact with water, and that that water dries off, my hands will
Hmm.
feel dry. So I pretty much moisturize every time after I wash my hands.
Yeah, that's something that's always confused me about physics, I guess, is like how it is that I wash my hands in water and then after I've washed them in water, they feel way drier than they did before. What is that? What is
Yeah,
happening?
yeah. So I think that's like a good segue into, there's this concept of transepidermal water loss. Have you heard that before?
No, I
Or
have
that
not heard that
concept before?
before.
Okay. I mean, it's just like a basic phenomenon that happens like every day, like happens 24/7, whether we're a lot or whether we're, asleep or climbing or
Okay.
awake. So basically what happens is that water, from the deeper layers from the dermis goes up to the epidermis and just evaporates into the environment. So that's normal process that happens. It's good that it happens because basically, I wrote it down here.
This is like not even sweating. This is like you're just alive. The environment is just sucking moisture out of your body
Yeah,
basically all
yeah,
the
it
time.
just yeah, and it's a good signal. It initiates skin barrier repair. But obviously, depending on where you are, your environment, sometimes you can have too much of it.
Hmm.
And so it can result in dry skin. So some things we touched on a little bit earlier was like environmental aggressors, like a very, very cold or very hot environment, dry weather conditions, lots of wind, lots of sun, things that, we're often exposed to when we're outdoor climbing, those
Hmm.
things can kind of increase the rate of transepidermal water loss. Aging, so as we get older, the skin barrier weakens and becomes less effective at retaining moisture. So getting older can kind of increase the rate as well. If you have like any pre-existing conditions like eczema or psoriasis, the skin barrier is already a little bit weakened, so that can increase the rate. And then water can also increase the rate. So especially hot water, because that hot water kind of strips the natural lipids on our skin barrier. And when those lipids are stripped off, that water's a lot, it can evaporate a lot more easily. Um, Cold water is a little bit better, but I feel like water in general doesn't like our skin's supposed to be a little bit waterproof. So water doesn't necessarily soak into our skin when we rinse our
Hmm.
skin. So it's not quite as moisturizing as we think it is.
Right.
It's just more drying.
So we wash off those lipids and those things that are kind of forming a little bit of a barrier, and then our skin is actually going to be a little drier. So then we want
Yeah,
to basically replace that with some kind of moisturizer
moisturize.
or something
Yeah.
to okay to facilitate healing.
Yeah, and the term moisturizer is also like a little bit misleading because a moisturizer doesn't like necessarily add water or moisture back to the skin like directly.
Hmm.
It does it with via like a few different kind of ingredient types. So like there's humectants that are in moisturizers, and then there's like occlusive ingredients in moisturizers. Are you familiar with any of these?
No, let's hear what these are.
Yeah, so occlusive ingredients, these are like, think of them as like the oily substances. So, like the climbing balms, that's like a really good example. Aquaphor, Vaseline.
Hmm.
A couple other examples would be like animal oils or vegetable oils. But basically, these ingredients, they sit on top of the skin and they create like this little oily barrier. So water doesn't evaporate quite as easily off into the atmosphere.
Okay.
Whereas the humectant ingredients, some examples of these are like aloe vera or glycerin, honey, hyaluronic acid, urea. There's like a whole lot. But these ingredients, they work by attracting moisture to that stratum corneum when it's applied to the skin. So it either brings in moisture from like, the environment around you if it's like really humid, or it just draws up moisture from the deeper layers of the skin and brings it to the top. So the top layers, yeah, get more moisture. And so
Okay.
most moisturizers, I feel like, have maybe a component of both in them to some degree.
Hmm.
Um, but what I generally do, like, especially if it's like the end of the day, I'll just put on like a good moisturizer and then like a stickier balm on top of it just to like really seal it in.
Gotcha. So I'm connecting some dots in my head here, which is that around here I don't really ever use anything except for Rhino Repair, which is
Yeah.
I'm not sponsored by them or anything, but it's not oily at all. It's like it is almost immediately off of your hands. So it must be
Yeah.
the humectant style, like it's trying to pull moisture in rather than being. Because I feel like a lot of balms, when I put them on, my hands remain like sticky for like a long time, and that bothers me.
Yeah.
But
Yeah.
I do use that kind when I'm in super dry environments because it does seem to like work a little bit better to keep my hands moist, and I'm now
Yeah.
understanding why that is basically. Um,
Yeah.
so that's cool. Good to know that there's like two different types basically.
Yeah. Yeah. I've used the Rhino Repair too, and also not sponsored by them, but it works really well. And I do think it has more of that like humectant variety too, but I feel like there's a lot of ingredients that kind of have both properties. So it's not like it's just straight up
Hmm.
one category or the other. There's often like a mix of both, but just
Yeah.
in general, that's kind of the way moisturizers work as a whole. Yeah.
Yeah, the ones that I've used that seem to be because I've gotten myself into like predicaments where my skin is just epically destroyed in the last like 5 years or whatever when I go to desert environments because I'm just a very dry person, and
Yeah.
I have found the ones that are best for like rescuing me from that situation are usually like super oily. So there's like a
Yes.
I forget who it is. I don't think it's Burt's Bees, but there's one that's like it's like banana scented or something, which is totally hideous. But it's like the
Okay.
oiliest thing I've ever put on my hands.
Yeah.
Um, but
But it works.
it really legit works. Yeah, I think it's based on how oily it is and what you're saying, it feels like what it's actually doing is just preventing that transepidermal water loss from occurring, so I can actually like
Mhm.
hydrate my skin from the inside a little bit.
Yeah,
Is that
yeah,
is that
that's
right?
exactly what it's doing. Yep, absolutely.
Okay.
And you could like layer it on. You could just put like a normal moisturizer on first and then like have the balm or the oily thing be the last thing you put. Other tips and tricks would be like if you really like have, messed up skin, like you could put cotton gloves on top of that too, and then
Hmm.
cotton gloves will kind of help make it penetrate everything a little bit more. Yeah.
Right, that makes sense. Yeah, I find when I go to like Joe's Valley or Waco or something, it's like there's inevitably one day on the trip where I just have like 9 band-aids on my hand and they're covered with
Yeah.
whatever that oil or substance is, and I'm like, well, I've
Yeah.
really gotten myself into the deep end.
Yeah. Yeah.
Yeah, I feel bad using that many band-aids, but I went through a phase where I would try to use like tape, like cheap tape, just because
Yeah.
it's so much, it feels less wasteful. But it really does feel like, because band-aids, I think they're made to create that like environment. They're made to kind of do that occlusive function, I guess.
Yeah.
And they do it better. Like it stays moist for longer. Is that what you would recommend if I had a flapper or a split that I was trying to keep really moist? Is a band-aid the right thing?
Yeah, I think Band-Aid's pretty straightforward. Like I feel like it won't have that sticky part on it that's covering the wound too. So that's kind of nice. It'll just have
Hmm.
that, that little Band-Aid gauze component. But that's usually what I do is like when I'm not climbing, and there's not tape on my fingers, like I'll keep it covered throughout the day if I have like a tear.
Hmm.
Especially if it's like a little bit deeper of a flapper or something, I'll usually keep it covered with a Band-Aid or like just some Vaseline and a Band-Aid, just to help it from healing. And sometimes I put tape over it to help the Band-Aid stay, but put the Band-Aid on first. Yeah.
Yeah. Yeah, that was something I think I got from our pre-interview, was like, because we chatted about some of these topics, and I think our
Yeah.
pre-interview, as is par for the course for this podcast, our pre-interview went way longer than expected, and actually I learned a lot just from that, and I probably should have been recording. Um, but I almost always do like antibiotic, if I have like a
Oh
legit
yeah.
cut, like a flapper or something.
Yeah.
And I think
Yeah.
you mentioned that, like, after the first thing or whatever, I could just do like Vaseline or something really straightforward. And I've been doing that
Yeah.
since. And it actually
Yeah.
works. I think it works probably better, because I think the other things that I was using like soak into the skin faster or like evaporate faster or something. So that was a good
Yeah.
tip.
Yeah, only reason I'm like, I feel like dermatologists have a bias against over-the-counter antibiotic ointments just because people can get like contact allergy to that. So if you use
Mm,
it for like a period of time, some people get sensitized and can get a rash to it. And so um most of the time those things aren't infected or anything. And so just a little
yeah.
bit of Vaseline, yeah. I feel like it's that ointment component to the topical antibiotics that help with like that greasy component that's helping more
Yeah.
than the antibiotic itself. Yeah.
This is probably related to like whatever collagen disorder I have. I'm not entirely sure what it is, but my wounds just don't heal quickly, and I have noticed that like antibiotic tends to like at least decrease the chances that it's just randomly going to take like
Okay.
3 weeks to heal or something. Because sometimes I get a little
Okay.
cut that
Yeah.
just does not
I mean,
heal.
if it works, yeah.
Yeah. So I'm not sure how often that's like a serious concern, but I do feel like climbing, especially maybe, and I don't know, maybe I'm uneducated for saying this, but I feel like climbing in the forest where it's really humid and there seems to be a lot of things that are alive, I feel like the chances that
Yeah.
my wounds will heal a little bit more slowly seems to be a little higher here.
Yeah. Just with
So
all the other microorganisms.
yeah, just a lot of stuff. I'm not sure how academically accurate that is, but we'll just go with it.
I can see where you're going though.
Yeah. What do you think about as far as the transepidermal water loss, and I don't know how much of this is your climbing experience versus your dermatology experience, but do you have an opinion on like putting your hands in the hot tub versus like being I feel like climbers always look like weirdos that they're like holding their hands over the hot tub
Yeah.
or like skipping hot showers and stuff. Do you think that stuff matters?
Um, if I really suffered with like super, super dry skin, then maybe I would avoid like very hot showers. But no, I mean, I'm gonna live my life, and so I won't keep my hands out of like the hot shower, like the hot tub, things like that. And I also know because I'm pretty good at like moisturizing my skin back, and pretty much like on a daily basis throughout the day, I'm using like some type of moisturizer on my palms, my hands, just because they tend to dry up more and haven't had issues taking hot showers or anything like that with it. So, yeah.
Gotcha. Cool. So
Mhm.
live your life, basically, is what
Live
you're
your life.
saying.
Maybe if I had like a project that was super, super like, I don't know, in a really dry desert environment and maybe I'd be a little
Yeah.
bit more avoidant of hot water.
Yeah, I feel like these days if I do those things, I just try to like drink an extra entire hydro flask of water, basically, because I
Yeah,
feel
same.
like
Okay.
that's kind of, and it's the transepidermal water loss. Now I have like the word for what's happening when I go to, these southeast desert places, but it does feel to me like no matter how much moisturizer I put on my hands, like it's up
Yeah,
to my body to hydrate my skin.
right,
Like I need to be
right.
taking on fluids and electrolytes in order to like replenish. So
Yeah,
is that like the
totally.
first aid and we should worry about that before we worry about putting stuff on our hands?
I think it goes side like I think they go hand in hand. I mean, obviously I
Okay.
think number one is drinking enough water. So if you're
Yeah.
but I feel like generally if you're not drinking enough, you're going to be starting to feel other symptoms that are probably more, problematic than just dry skin. So yeah, definitely
Hmm.
take care of that first. Is stay hydrated enough. Um, and especially if you're in higher elevation, I feel like
Hmm.
the elevation as your body adapts naturally you go to the restroom a little bit more, there's more diuresis as you're adapting to higher elevations, so it's normal to feel a little bit more dehydrated if you're up you know at a higher level than you're used to being.
For
So yeah.
sure. Yeah,
Yeah.
you just lose more fluids in general from all
Yeah.
angles, I guess. Yeah. They're harder
Yeah.
environments. I don't want to, I think because we both have dry skin and I'm so vocal about my dry skin, I don't want the whole conversation to be about that. So
Yeah.
on the notes of like what things you apply, the humectants and occlusives and,
Right.
things like hot showers and stuff, for people who are on the other side of the spectrum, people who feel like they have really sweaty skin, how should they treat this stuff? Should they be using these kind of products? Should they be doing anything special?
Yeah, that's a great question. So my husband, he's also a climber, but I feel like he's a little bit more on the sweatier side than me. Like, doesn't really need to put on chapstick or moisturizer unless he's really in like a desert environment. So he does not moisturize his skin as much as I do. I still feel like after climbing, specifically after the activity, it's helpful for him to. He also doesn't use any type of like anti-hydral or anything like that. So I feel like
Hmm.
I mean, in terms of just like moisturization recommendations, I feel like just go based off how your skin feels. So if it's feeling like dry or tight, or if you have like open cuts or tears or flappers, pay a little bit more attention to any occlusive you're putting on your skin, maybe a little bit more moisturizer. But I would just say go based off how your skin feels. And usually that feeling of like tightness, I think that's a pretty good indicator. That
Mm.
tightness, that discomfort. Yeah.
Okay, so when you say tightness, you're talking about like just a sensation that the skin is kind of like drawing itself
Yeah, it's just like
together.
dry and tight. Yeah,
it's not very plasticky. It's not very like what's the word we're using?
pliable,
Pliable. Yeah,
supple. Yeah,
yeah.
yeah.
Okay, that's
I
a
think go
sign that
based
maybe we
off
should
that.
moisturize.
Yeah, that's usually my sign that I should moisturize. And then, depending on the environment I'm in, sometimes it has to happen a lot more frequently and sometimes way less often. So,
Okay,
yeah, that would probably be my litmus test for
yeah. But the
moisturizing.
basic rules, whether you have dry skin or sweaty skin, should be the same, right? That if you go climbing and you fuck your skin up real bad, you need to wash it and put some moisturizer on it to help it heal faster. Even if you have like wet skin, that's probably still true, right?
Yeah, so by wet, you probably mean like you're kind of getting down to that lower layer of the epidermis. It's getting all raw. I mean, I think that's especially when you want, if you're done climbing, yeah, put on some moisturizer afterwards.
Hmm.
Um, but like, I can't say, for someone who has like really sweaty skin, like maybe
Hmm.
more leaning towards like the hyperhidrosis side, um, they already have that, a little bit extra moisture than like the dry person does. So I'm not gonna
Okay.
say that they have to put on moisturizer, but unless it's like an open cut or something like that.
They might be like closer to the max of like how fast their skin could be healing anyway, if that's a real thing.
Maybe, yeah. That's a good
Okay.
question.
Okay. Yeah, I mean, I don't want to like generalize too much. I
I
think
know.
one thing I've learned coaching people and talking about skin is like the first thing I feel like people need to do is just turn off all the stuff that they're doing because there's
Yeah.
so many different things that you can apply and habits that you could fall into and stuff. And then of course people are usually climbing 15 hours a week or
Or
something.
more.
Yeah, and like taking quite a bit of damage in that process, so it can be hard
Right.
to even know what your baseline is.
Right.
And then
Right.
people sort of make assumptions about like what's working or what's not working, but they don't actually know like what their skin is normally
Yeah.
like. So if you're just
Yeah.
always in the gym going down to hamburger and down to that like lower dermis layer that's like
Yeah.
super wet, then
Yeah.
you're going to think you have moist skin, but it could just be
Yeah.
that you're climbing a lot. It's really hard to say, I think.
Yeah, yeah. They're probably not
Um,
going down to the dermis itself, but yeah, down to that very low
right.
epidermis.
I should stop saying that. Yeah. It doesn't. It's not like
It's
actual
okay.
flesh. Yeah.
It's okay. Just thought about that for a sec. Yeah.
So we talked about. I guess we've talked a lot about like general skin healing and a little bit about like wound healing. Is there anything about wound healing that we feel like we haven't covered?
So I thought one thing that, you were kind of talking about like all these topicals that we could be putting on our skin. One, ingredient that I wanted to talk about, or just like subcategory of ingredients, were topical keratolytics, because I think that they are relevant to climbers too.
Okay.
Have you heard about, are you familiar with keratolytic? Okay.
No, and
Keratolytic
I'm
is
loving this
basically,
theme of you asking me if I've heard of something and me being like, no, I
yeah,
can't even
no
pronounce the
problem.
word you said.
No problem. Keratolytic. So
Keratolytic. Okay.
this is an ingredient type basically that turns over your skin or exfoliates your skin, essentially. Think of it like that. Think of it as like a topical ingredient that does like the job of like a nail filer or like a filer to your skin.
Okay.
So if you're familiar with like the Rhino Repair Cream, that has like that willow bark extract, which is a source of salicylic acid. So salicylic acid is a keratolytic.
Okay.
Other ingredients that fall into this category, so there's like lactic acid, there's glycolic acid, salicylic acid, urea. There's a lot of ingredients that fall into this category. And so you can get like prescription versions of some of these things that are pretty strong, but there's a lot of over-the-counter versions that people can get that are much gentler. And oftentimes they come in like serums and stuff for the face, but they also come in cream forms for like, as moisturizers. And so the moisturizer I've been using a little bit more recently is just like a moisturizing cream with a little bit of salicylic acid and lactic
Hmm.
acid in it. And I think this just compared to just this is my N equals one, experiment,
Hmm.
but like compared to just using a moisturizer, when I use a moisturizer with these ingredients and just a small amount, I feel like my skin is a little bit more, I don't know, filed down, like it's just less rough. It catches a little bit less. And so that's probably one reason why the repair cream works really well too, is because it's got that ingredient in it, the salicylic acid.
Yeah, that totally makes sense. And my root word logic is saying kerato is like skin, right?
Yeah, yeah, like
And lytic is
keratinocyte.
like
Yeah.
breakdown. So it's literally
Yeah.
like breaking down that top layer of skin a little
Yeah.
bit. Is that
Yeah, it
okay?
breaks down that top layer to increase overall turnover of your skin. So it kind of helps with
Gotcha.
that
Okay.
process.
Do you still like file or sand or anything, or is this is just like taking that work off your plate, basically?
It takes the work off. I'm like more of like a less is more type person, so
Yeah.
I don't file or sand like really barely ever. I do
Hmm.
clip like if there's something that's like sticking out. But I mean that's also because of the climbing that I'm doing. It's not like, these days I'm doing a lot more bigger holds and more like steeper climbs where I feel like if a little
Hmm.
bit sticks out, it's okay. But
Oh, okay.
yeah,
Gotcha.
I mean, I feel like I should probably be a little bit better, but clipping usually does enough if something's like sticking out, and then
Hmm.
using a moisturizer with a little bit of like salicylic or lactic acid is doing a lot of the work too. So,
Okay, that's so.
um,
Would you say in the realm of like all the different things you could put on your hands that that's more of just like a thing you would consider as a regular preventative? So something like
yeah,
Rhino Repair that has a little bit of that ingredient in it, or some other moisturizer that has a little moisturizer that has a little bit of it in it, would be something you
yeah.
just use a couple times a week or something to just make your skin a little more supple.
Yeah, I just use it as like my general moisturizer. So if you just go to like any pharmacy and you kind of look in the moisturizer sections, the ones with these ingredients, they're often like for moisturizer for like rough skin or like rough and bumpy skin. Like those are kind of like the words, that are going to
Hmm.
clue you into, oh, it probably has like, some type of topical keratolytic in there. Um, and so, I mean, you can just replace it as your normal moisturizer. You could just do it at night. Yeah.
But that's not going to make your skin softer necessarily. It's just going to make it like more smooth.
I feel like the term pliable and supple is how I would say my skin is, but
Hmm.
I mean, if you're gonna put on any moisturizer, your skin's also gonna feel softer than it would compared to if it was dry. But
Yeah.
it's kind of why I was wondering earlier, that you try to aim kind of towards more hardened, dry skin. Um,
Well, it kind of depends. It really depends on the climbing I'm doing. Like as an
yeah,
example, like I've been to Bishop a ton of times, and I've never seriously sunk any time into this famous problem there called stained
right.
glass, which is like, have you ever seen that problem, or do you know that problem?
I don't know if I have. Yeah.
It's like it's like a barely overhanging wall. It's V10. The holes are like really, really, really small. They're like, quarter pad
Okay.
crimps or something like that.
Yeah.
Um, and basically every time I've tried it, I try it just a little bit, and I'm just like, oh, the skin on my actual fingertip, like right in front of the nail, like the very
Yeah.
front of the fingertip, is just not hard enough. Like I could try it like twice or something, but I would need to like try it twice for a few
That
sessions
makes
before my
sense.
skin was
Yeah.
hard enough to try it more.
That makes
And I just feel
sense.
like if you try something like that with really supple skin, I'm gonna split in like 20 minutes basically, if that makes
Yeah.
sense.
That makes sense. So, yeah, I guess like with, moisturizers that have these ingredients or just in general, it might be dependent on the project that you're working on or the boulder
Hmm.
problem. And so, I mean, it can be really beneficial if that's not what you're working on and you just kind of need more supple skin in general. But yeah.
Yeah, I just find supple is a good thing to aim for in general because
Yeah.
with as someone with dry and like reasonably hard skin in general, I feel like
Mhm.
if it's supple, it's less likely to tear. And like I think of tearing or skin tears, especially on my tips, as being like an existential threat to the session.
Yes,
Basically, it's like if you get a tear or a flapper on the tip, like your chance of sending something is like
I
yeah
agree. I
real low.
agree.
Yeah, I always kind of think of it. I don't know how true this is. Maybe you can check my theory. Here's another crackpot theory for you. Um, I always think of skin as having like there's like a dry to wet spectrum, and then there's like a hard to supple maybe or something like that spectrum.
Okay. Yeah.
And then there seems to be like a thick to thin spectrum too, because I've met some people who their skin seems fine and we climb for 30 minutes and then they're complaining about how bad it hurts and they're like, look at it. And I look at it and it's like pink and we've been climbing the same amount. And I'm like,
Yeah.
oh, yeah, wow, yeah, you are out of skin. Like, how did that happen?
Yeah.
Is that a
Yeah.
real thing? Like some people have fewer layers or,
Yeah, I mean, I know that there's just variability between person to person in terms of layers. So yeah, I mean, I think that's totally possible.
hmm,
Um, I don't know if there's a way of like, if it's just purely like a genetic component or if there's something beyond that. I mean, without being like, you know, some type of medical condition. But I've
hmm,
I've also met those people too. And I think there's just maybe a difference in there's probably a combination of things. It's probably like, moisture levels in the skin, also skin thickness, also, how their skin has adapted to the climbing that they're doing. Probably a
yeah.
combination, but yeah, I do think
Yeah,
skin thickness plays a
I feel
role.
like skin and skin genetics is one of those things that's just like rarely talked about. It's like
Yeah.
I feel like all the World Cup climbers who are doing, 4 intense rounds of climbing in 5 days, and they're all taped up at the end of it, but like it seems like the people who do the best have less tape on and they're probably doing less tries like in the bouldering rounds and stuff, but also I
Yeah.
always wonder like do these just people just have the toughest, thickest skin a little bit and we just like don't talk about. We're all like focused on their height, but like I
Yeah.
feel like there's a whole skin genetics thing that
I
we don't
know.
really
They
talk
probably
about.
don't have thin skin, so
Yeah, for
there's
sure.
that. Yeah.
It
Yeah.
would be super tough to get by if you had thin skin. Okay, so maybe there's not everything can be explained away with a product, but the wet to dry cycle. So we've talked a lot about wound healing and moisturizing. We haven't gotten into products that you can apply to sort of make your sweaty skin drier, but there's a lot of those
Yeah.
out
Yeah.
there.
Yeah.
I think the biggest one is you mentioned antihydral, which is methenamine, right? And then there's like a
Yes.
bunch of other products that also have different percentages of methenamine in them.
Right.
I've heard horror stories like it's like filling your sweat glands with formaldehyde or something like that. I'm not sure. Do you actually know how it works or what it's doing?
Yeah. Yeah, I do know how it works. It's really interesting because like I feel like so I'm familiar with like basically a lot of like the topical antiperspirants, but methenamine specifically, we didn't like prescribe or learn about as much in residency or like board questions or even the board exam or anything like that. So I had to look up some papers about it. And I don't know if it's more of like a European medication and maybe
It is.
yeah, it's
Yeah, my
prescribed there
first
more.
tube of
Okay.
anhydrol I actually bought from Germany, um,
Okay.
and then
That would
had a
make
horrible
sense.
experience with it because I have really dry skin, and I was like, cool, this was $50 or whatever.
Yeah, I mean, so methenamine, it's got an interesting or like a fun little mechanism of action. So basically, whenever you apply it topically to the skin, to my understanding, there's a slightly acidic pH in the skin, and that breaks down the methenamine into ammonium and formaldehyde, and that formaldehyde will evaporate out, but
Okay.
as it's kind of before it evaporates out, it denatures proteins in the sweat duct. So it creates this little protein plug of just denatured protein. So the formaldehyde's gone, but then that protein plug remains. And that plug basically blocks sweat from coming out of the sweat glands, and it lasts for, 2 to 3 days or so. So that's how methenamine works.
But just keeps building up or circulating or
Yeah,
something.
it
It's
keeps
just
building up or circulating, but it doesn't come out.
okay.
And so yeah, that's very similar to how a different topical antiperspirant, aluminum chloride, works. But in the case of aluminum chloride, you've got to apply it to really dry skin, so you have to apply it like at night when you're not sweating. And
Hmm.
the aluminum goes into the sweat duct, creates a little like block basically and keeps
Okay.
that sweat from coming out. So,
Okay.
yeah, similar mechanism of action.
I I don't know like how much research there even is, but like, is it okay to be plugging up our sweat glands with aluminum and proteins, or are there long term risks
Yeah.
of doing that?
So aluminum, that's like a whole other rabbit hole that, you know, I feel like I don't have the expertise in, but I just know people who'd rather avoid it just because of, potentially being like an endocrine disruptor, neurological
It seems
toxin.
like a weird thing to put in your body.
Yeah, so it's not one that I prescribe or recommend a lot. And it's something that, a lot of my patients avoid in general too. But just bringing it up because it is used commonly for like,
Hmm.
for antiperspirant properties. With regards to methenamine, I mean, it's a protein plug. It's not like aluminum. Um, I don't think there's any data showing like the harm in that. Um, and then with the formaldehyde, that's evaporated out. I think like from a dermatologist standpoint, there are people who have formaldehyde allergies, so that would be like one reason to potentially avoid methenamine. But I did find like a study, it was like a pretty old study back in like the 1970s of a patient. Um, like there are a series of patients, but one of them actually had like a patch test proven formaldehyde allergy, and they tolerated,
Hmm.
methenamine well for hyperhidrosis. So maybe
Okay.
if you have an allergy, you'll be okay with it.
Do people who have hyperhidrosis just use methenamine products like 24/7, 365, basically, or do they need to stop taking it at some point?
Yeah, I think generally with like topical antiperspirants, you do it maybe every 2 or 3 days to begin with, or maybe even every night for a couple days just to like kind of build up to your goal dose or your desire. And as tolerated, right? Because a lot of the topical antiperspirants can be pretty drying to people. So unless you're super sweaty, even if you do have like full-on hyperhidrosis, you may experience irritation to the skin. So you kind of build up to it every other night, every couple nights is tolerated. You get to the goal and then you can kind of taper down use to, however many times a week, once, twice a week, kind of as needed for maintenance.
Gotcha. My big mistake that I made the first time I used anhydrol was I thought it was just like I would put it on like a balm, basically. So I just like put it on. I just rubbed it into my hand, my whole hand, and then proceeded to get like splits in all my creases, pretty much.
Oh
And it took
no.
like a month for them to go away. Um, and since then, I've learned. I mean, first of all, antihydrol's like 17% or something. It's like super high
Yeah, I
percentage.
think so. Yeah.
And then there's like lower products, like I've used the Performance. It's like 2%, I think. And I've
Yeah.
learned now to I just put some on my palm, and then I like dab all my fingers in it, and then I like just rub my fingertips, my very
Not
fingertips
the
together, and like
greatest.
yeah, and make sure it doesn't
Yeah.
get in any of the creases, or I'll get splits for
Yeah.
sure. So I don't know if
Yeah.
that's like a safe thing for people to do, but I've always just
That's a
used
good
it
tip.
2 sleeps before I want my skin to be a little bit drier, and I don't
Yeah.
use it
Yeah.
like consistently generally. But it sounds like and this makes sense with the people that I've talked to who think they have really sweaty skin too, that it's like most people maybe just use it pretty consistently, like every few days or something, kind of indefinitely, and that's maybe like safe to do.
Yeah. Yeah, I haven't seen any safety data just for long-term use for, methenamine saying it's negative or anything like that. So nothing
Okay.
that I'm aware of. Yeah.
Yeah, so if you have sweaty skin and you use anhydrol, that's probably fine as long as you're not
Yeah.
having like obvious problems with your skin that are like it's too dry and you need to back off of it pretty much.
Right. And I like, potentially doing like the lower strength ones, like you mentioned, like if you don't have like straight up hyperhidrosis, but you just want to do something to reduce the sweating a little bit, that's
Hmm.
probably doing lower strength is probably going to be better to avoid, that irritation and dryness and peeling.
Yeah. Yeah, I've the only other places that I've seen I did a little bit of research, and the only other places that I've seen these products used other than like clinically, like people having hyperhidrosis. Well, I know this because I know the guy from Rhino. Shout out Justin. I don't think he listens to my podcast, but I know him from Bend. I know he markets to gamers also, not because they
Oh,
want their skin to be dry, but because if it's like sweaty, they'll slip on the keys when they're going really fast, apparently.
oh wow. Yeah. That makes sense. Yeah.
He also markets to like MMA people because they
Okay.
want their skin in their on their feet to be dry. I guess I'm not
Okay.
100% sure
Yeah.
why. I don't
Yeah.
know anything about MMA.
Yeah. I mean, you could use it in those areas too.
Right.
Um, Yeah, I guess you could technically use it in the underarms as well if you need to. Yeah.
What what other products do people use for like drying their hands out? Are there other things that you think would be relevant for climbers, or are those all like clinical hyperhidrosis things?
Yeah, so there's a device like iontophoresis. I think we briefly
Okay.
chatted about it last
Yeah.
time. I think that would be a good option too because it's not like a medication or a pill or topical medication that you have to do. It's a device. You can get it via like a prescription, but I think you can easily get it over the counter too. It's not like the most cheap device to get. I think it's maybe a couple $100. You can use iontophoresis for like the hands, the feet. They even make like a device for the underarms, that you could do.
Whoa.
Yeah, but I've tried it for the hands a couple times in residency, just to kind of see how it would feel like. They had us do it while we were learning about it and stuff. But basically, it's like a tray of water. So you have a tray and it's got electrodes within that tray. And when you turn it on, when it's filled with water, there's like a current that travels between the electrodes. And the exact mechanism of action is unknown. So we don't know why or how this exactly works for hyperhidrosis. There's like a
Whoa.
few theories. Yeah, there's like theories that like the ions produced by iontophoresis can like physically block the sweat ducts and prevent, sweating from happening. There's a theory that like the current it can disrupt normal sympathetic nerve function, which contributes to sweating. Maybe changes in pH. Not exactly sure how it works, but it helps to reduce sweating. You can kind of do different levels of it too, so you can adjust based on how much you can tolerate. And so it feels like a pins and needles sensation, maybe like a slight burning sensation when you're treating your hands. Treatments usually maybe about like 20 or 30 minutes max a day, maybe every 2 or 3 days until you kind of get to your goal. And then you can do it like once a week, twice a week for maintenance.
Hmm.
Uh, yeah,
It's like very mild torture, basically.
very mild torture, no medication needed. Yeah.
Yeah, I had a client who, yeah, this is the first time I actually found out about this. A client who was like, I think I'm going to make my own iontophoresis machine because I want to try it and it's too expensive. And then I like read about
Yeah.
what this was and I was like, wow, you have a lot of faith in your own electrical engineering skills if you're going to make that machine and put your hands in it. But
Yeah.
it's crazy to me that we don't know exactly how it works. So someone just sort of electrocuted themselves a little bit and was like, wow, I'm sweating less. And then it became a treatment.
Yeah. Yeah, I don't know how it originated actually, but yeah, I mean it's pretty well tolerated by most people. I think the only times you don't want to use it is if you have like some type of metal implant,
Mm,
pacemaker.
totally.
I think it's not well studied in pregnant women, so probably avoid it. And then I think seizure history is the only other potential
Gotcha.
contraindication for it. Yeah.
And this is something that
Yeah.
people would potentially use in conjunction with other things like methenamine, or would it usually just be by itself?
Yeah, you could use it in conjunction. I mean, I feel like, it does have pretty good effects, and so you may not need to use an adjunct with it. But I think that
Mhm.
just depends on how much sweating you're having and how often you're using it.
What about, are there other things? I think I've seen like tight grip I saw somewhere, and then I've seen like dry salt. There's like all these other, weird
Yeah,
drying products. I know
yeah.
that some of those are things that you probably want to be really careful about using with climbing because they might leave weird stuff on the holds. Like
Oh,
I think
okay.
tight grip is something that you probably shouldn't use when you're climbing outside. Yeah, it's just something that I
Yeah.
saw somewhere, so I'm not trying to like throw you random curveballs, but
I'm not familiar with tight grip. Dry Sol's aluminum chloride.
oh, it is
So,
okay.
yeah,
Got it.
that one's aluminum chloride. And then there's like many other brands that make some kind of aluminum chloride type of thing with other names. Can't think of them off the top of my head, but yeah.
So dry salt would be one of the ones that you would put on at night, like with gloves.
You'd want to put it on at night on to dry hands,
Dry
basically,
hands.
so that
Okay,
aluminum can, yeah, the aluminum
gotcha.
can go away without sweating off. Yeah.
Okay,
Mhm.
I'm trying to think of what stuff I've missed in the basics. I feel like we've covered a pretty crazy amount of stuff.
Yeah.
Oh, I did have one more question with wound and skin healing.
Yeah.
I was trying to take notes as we went, but I was also very absorbed in all of the things you were saying. So, um, my question was, I've done this dumb thing a few times where I get a flapper and then I'm very stubborn and I don't want to stop trying, so I just wrap it with a bunch of tape. And
Yeah.
sometimes I even do the same thing like the next day,
Yeah.
wrap it in, and it hurts like hell. Is that like, do you think that's like delaying the healing of that thing? Is that stupid to climb? Like, I know that tons of climbers do that, so I just want to ask the question.
Yeah. I do that too. I I don't think it's delaying it too much. I mean, unless you're probably tearing it up more, but I feel like the tape is probably, helping it out because you're getting that layer of padding over it. I mean, I think, probably just go by pain. If it's too painful, probably take a break from it. Yeah, but
Okay.
I don't think it's necessarily going to delay it too much.
That's not going to
It
stop
already
very many
takes
people, I
long
don't think.
enough. Yeah, it already takes long enough as is for like a flapper to fully heal. So,
Yeah.
yeah.
Yeah. Okay, that reminded me of another thing, which I stole from, I think, Jonathan Segrist way back in the day, which was
Yeah.
he said if you wanted to heal, I don't even know if this was actually Jonathan Segrist, but I think it was that if you wanted to heal like a split or a flap as fast as possible, it was to cover it, to alternate between covering it with something and then leaving it open to the air.
Okay.
I think he said every 30 minutes or something. I'm not sure if I was
Okay.
doing it that frequently, but does that make any sense with these theories that we've talked about today? Or science, really? It's not
Um,
theories.
the only time where you maybe don't want to keep it covered if the wound is like, too exudative or basically it's like too wet. If
Mm-hmm.
it looks like it needs a little bit of drying up, which I feel like generally like splits or tears or flappers aren't in that category. Just like the hand, skin on our hands is pretty dry to begin with. So I think just keeping it covered is fine.
Just
That
keep it
should,
covered.
yeah, just keep it
Cool.
covered. Yeah.
I love how much of
It's
this is just
simple.
like low key, low anxiety. It'll be fine. Love it.
Yeah.
I think we can move on to the questions that people send in because some of these are kind of interesting too,
Yeah. Yeah.
if that sounds good. Okay.
That sounds good.
And we've talked generally about a lot of this stuff, but maybe there will be some other nuggets of wisdom. I'm not sure. So
Yeah.
these first two questions are from Casey, who I know. So hi, Casey. She says, when it's winter bouldering season, how best to manage really dry skin? I use moisturizers at night. I clean my hands after climbing. While bouldering, I use Rhino Spit, which we didn't talk about.
Mm.
So maybe we should talk about that too. I sand it, file it, do whatever I can, and I still dry fire all the time. The colder it is, the worse it gets for me. Any advice? And just some context for coming from having climbed with Casey a few times. She dry fires more than anyone else I've ever climbed with.
Wow.
And
Yeah.
maybe is like one of the only people I've ever met who has drier skin than me. So like when it's really cold and dry, I can see, it's just you need some
Yeah.
moisture, I think, to have a little bit of
For
friction.
sure. To have that grip. Yeah. Yeah.
Yeah, which is the point of Rhino Spit, which we didn't talk about, but if you have super dry skin, then even putting a little bit of water on your hands.
Yeah. It's got that little bit of aloe vera in it that I just remember I haven't tried it myself. I'm like, oh, this is probably something I need to try too when I'm in a really dry environment. But yeah, it's kind of like a way of adding some moisture back to the skin without being too oily. That's like my understanding of it. So you
Hmm.
can climb with it on, has that little bit of tackiness back to your skin.
Yeah. Yeah. I've found it to be a little bit better than just putting water on my skin and waiting for
Yeah.
it to evaporate and then chalking up and going.
Yeah.
Now I understand it's because of that. Would that be a humectant or what?
Yeah, the
The
aloe
aloe vera?
vera. Yeah. 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 It would draw moisture to the skin. Yeah.
Right. If I'm climbing on wood holds in a really cold environment, like in my garage, or if I'm climbing on a super polished type granite, so like
Yeah.
full service in Waco tanks was one where like coming back down there, I had tried it in the past, and coming back down there with spit, it was like much easier to climb on those
Really.
holds
Okay.
because I just had way better friction. So sounds like
Yeah.
Casey already has that stuff kind of figured out. Do we have any other advice for the driest skin on the planet?
Yeah, I guess I just want to know what Casey's doing, like outside of climbing, like throughout the day, what the skincare is looking like, how often Casey's moisturizing her skin, what moisturizer she's doing. Is it only at night that she's moisturizing the skin, or is it like throughout the day? So kind of things that she's doing outside of it.
Would you recommend more often, you think, potentially?
Yeah, I mean, I would if it sounds like her skin's pretty dry like mine, and so I moisturize throughout the day. So anytime I kind of get that tight feeling is when I do apply a moisturizer. And then at night, I'll moisturize and then put on like, that more occlusive balm on top when things are super dry like that. And
Mm-hmm.
then even sometimes like on the way to the crag, if the environment's like super dry, I'll moisturize on the drive there. And by the time I get to the wall, it's going to be like dried up again. So.
Mm-hmm. And that's with like a humectant type moisturizer that you would use on the way to the
Yeah,
crag, or
so what I would just recommend, the thing to look for is just a very gentle over-the-counter cream. Cream more than lotion. Lotions don't tend to be as moisturizing as creams do. And so, I mean, I'm not sponsored by any brands, but things like CeraVe, Cetaphil, Vanicream, like the most gentle, basic, nothing fancy. They get the job done. They're not super expensive. Look for a cream more than a lotion. Creams are going to add that moisture back, especially after you wash your hands. That water is going to evaporate whatever, or it's going to remove, that skin barrier of lipids and stuff. And so, yeah,
okay.
returning that moisture back. I don't know, any other tips you have from your experience?
I've already talked to Casey. We've talked about skin at
Yeah.
great length, so
Yeah.
I don't think I have anything extra to really offer other than you know, for from my personal experience, I just adjust my. This is probably what no one wants to hear, but I just adjust my expectations when I go to the desert. I just can.
Yeah.
I straight up climb harder in a humid Northwest environment than I can in the Southwest, where it's really really dry. There's no getting around it. Like I can try
Yeah.
more here. My skin holds up better here. I can have longer sessions here. I'm not going to get splits here. My skin is just not as much of a limiter here, and so that's why I live here at the end of the
Yeah.
day. I still like climbing in Waco Tanks and Joe's Valley and stuff, but I expect to climb like about a grade lower there than I do here. That's just,
Gotcha.
yeah.
Yeah. Yeah, that's kind of whenever I am in a desert environment climbing, like my moisturization habits are like definitely picked up. Chapstick,
Hmm.
moisturizer, everything is just like throughout the day. So it's like what I'm doing when I'm not climbing is like pretty much just as important as what I'm doing when I'm climbing. And so,
Totally. I have like my skin kit that I bring everywhere, but if I'm going on a trip to the desert, I have like a whole second skin kit, with all
yes,
the band-aids and the
yes,
lotions and
all of that.
moisturizers, and
Yeah.
I just don't need any of that stuff here at all. And I guess I sort of phrased it in the negative of like I know I'm going to climb worse there, but the flip side is like you could just say I know I'm going to climb harder here, which is why I live where I do, and that's the
Yeah,
kind of positive way to think about it, I guess.
hopefully.
I gain a
Yeah.
grade here.
Exactly.
Yeah. I mean, that's the same as like if you're on the shorter side or the taller side, you're going to have limitations in your climbing. And I think your skin is the same thing. So probably managing your mindset is the most important thing. You want to do everything, you want to control the controllables and do everything you can to manage it. But
Hmm.
yeah, we don't all have exactly the anatomy and body that we want. So it
For
goes.
sure.
Second question, which might be more nuanced. So Casey says, I also go through periods where my skin feels really fragile. Recently, I've been sport climbing. The weather has been hot. I seem to rip new large holes every time I go out, in addition to splits in the creases. My friend, who's a PA, prescribed a steroid cream, clobetasol. That has seemed to help a little, but it's really been a struggle. It's almost like the top layer is not adhering to the bottom one, and there's no elasticity. And all of the holds feel slippery. It doesn't help that there's tape all over my fingers. I keep sanding and filing and using ointments. The top layer not adhering to the bottom layer thing, I've also had that, but only
Okay.
very recently, where it was super windy,
Okay.
and I I was just holding it like a kind of a meat hook hold, like an
Okay.
undercling basically, where I was ulnar deviated on it, like kind of
Okay.
rotated, and
Uh,
as I moved off of the hold, my skin like rotated on the granite, and I got
okay.
a basically a flapper, but it was just from twisting, just from like
Yeah.
pressure of the rock
Yeah.
twisting against my finger. There was no like I wasn't catching it or anything. And where the flapper was, there was no blood. There
Yeah.
was no redness. It was just like 20 layers of skin came off. It was deep. Yeah, and there
Okay.
was just no moisture underneath there at all. It wasn't attached to
Yeah.
anything, and I was like, "Whoa, what is happening? Am I just the most dehydrated I've ever been?" And it sounds like maybe Casey's having a bit of the same thing. Do you have any input on that?
Yeah. So when you get that flapper, you trim it off, right?
Yeah,
Basically, yeah. I mean,
yeah.
I think it seemed, and I know what you're talking about because I've had the same thing happen to my skin
Okay,
too, where it
yeah,
looks like it's not attached. It's just not that moist there, which is why it hasn't like attached.
yeah.
So that's kind of what I feel like is probably what's happening when the layers don't feel like they're adhering to like the bottom layers, and there's maybe just not that much moisture there. And so if you're, after climbing, whatever, if you just keep it covered, Vaseline and a
Hmm.
Band-Aid, throughout the day, it's going to help with keeping it adhered a little bit better and then therefore help with the healing. So just don't
Okay.
maybe let it air out too much.
Any input on using a steroid cream to would that have any effect here?
Yeah, so clobetasol is a pretty high potency topical steroid cream, and it's one that it's safe to do on the hands, but I think for like things like just traumatic cuts, flappers, tears, I don't think it's gonna accelerate the healing. I think a steroid cream may potentially slow down the healing process actually. And so in those cases of like open cuts, tears, flappers, I'd probably avoid a steroid cream. I'd just put on, some gentle ointment or emollient on
All
top.
right,
Yeah.
cool.
I
That
mean,
might be
unless you're
useful.
getting like irritation to the hands, like if you're getting irritation from something, rashing, other redness due to other reasons, a steroid cream might be helpful to calm some of that inflammation down. But
Got it.
yeah,
Okay, but not specifically for like the holes and stuff. That's okay.
no, I wouldn't use it for that. Yeah.
Okie dokie. Good luck, Casey. Maybe move somewhere more humid. She's not gonna. Okay. The next question is from Anonymous. So I'll just read this whole question. So it says, "Do you know of any skin?" This is the TLDR. "Do you know of any skin slash climbing related skin injury improvements from supplementing L-lysine daily?" Okay, and then they say, "This is kind of an awkward backstory. My boyfriend had herpes since birth from his mom, and I contracted it from him 6 months ago or so. And while he's been living 31 years with it, I was annoyed after the first experience and went down a research rabbit hole, found several papers related to L-lysine and reducing infection occurrence and severity of outbreaks. So we both started taking lysine daily and have seen dramatic effects with reduction of occurrence and severity, which is pretty cool. There's some mechanism with lysine and wound healing slash collagen formation. Anyway, I've had the best skin of my life for climbing since I started taking 2 grams of lysine daily. So my question is, if the dermatologist knows of any effects of lysine supplementation on climber skin or climbing-related skin damage and healing time, it would be cool if there's some research instead of my N of 1 subjective, accidental, game-changing discovery." I'm guessing there's no climbing research because we barely have climbing research even on climbing stuff that really is super important. But
Yeah.
yeah, do we know anything about L-lysine? And because it
Yeah.
sounds like
Yeah.
this person has the best skin they've ever had.
I know, and I want to know, like, how is it? Is it just like healing better? I want to know how exactly it's better. But anyhow, lysine is something I also recommend to patients who like, have herpes simplex virus, HSV1 or HSV2, because it can. There's a lot of papers just out there, nothing super huge or big, but just papers showing that it can reduce the frequency and then the intensity of herpes outbreaks. And so I actually get cold sores on my lips when I'm like, in some specific cases, like when I'm out in the sun a lot or if I've been sick, I'm more prone to getting it. So I actually supplement with lysine too.
Hmm.
I do closer to like the 2 grams, 2 to 3 grams when I'm like actively having an outbreak, or if I feel like I'm in a situation where I'm about to get triggered and may have an outbreak. But on like a daily basis, I'm maybe just taking, and there's no reason why I'm taking this low of a dose. I'm just taking, one of my capsules, which is like 500 milligrams a day. I don't know if I've actually noticed a difference personally on such a low dose with my skin, and I haven't taken it at the 2 grams daily to know myself if it's had an improvement. But I mean, I guess it would make sense why it would help. It's because lysine is an amino acid. It's one of the essential amino acids that our body can't make, and so we have to get from, our diet or through supplementation. And it plays an
Hmm.
important role in collagen cross-linking. And so collagen, as you know, is super important for the skin. And so lysine basically helps to cross-link those collagen fibers together. And so it would, I guess it would make sense that it would help with wound healing and skin care in general for climbers. But like you mentioned earlier, there's not really any studies showing how it does it or at what dose.
Yeah. But we have tons of studies for collagen,
Mhm.
most of them pretty lackluster, and tons of people supplement collagen. So
Yeah, yeah.
maybe if you're trying to fix your skin up, you could consider taking some lysine.
I don't think
Hmm.
it has really any negative side effects if you're just taking it at that, 1,500 milligrams to 3,000 milligrams a day dose, which
Yeah.
is kind of that general range for HSV prevention or outbreaks. Um,
Hmm.
I mean, I think it maybe for some people you may have some stomach upset, but I think it's overall really well tolerated and no major side effects I know of, so long as you're not taking a super high dose.
Yeah, and given that it's an amino acid, I didn't look this up before our podcast, but I kind of wonder if this person's potentially vegan or vegetarian, and if it's something that's like primarily found in
Yeah,
meat, because it could be that if you were vegan or vegetarian, maybe you just get a
you're
little
already
bit less
kind
of that amino
of.
acid in your diet. I'm not sure, but I don't know. Yeah.
Yeah. It's found in both, animal and plant-based
Okay.
proteins, but if your diet is low, maybe on the lower end for protein in general, there is a possibility that you're getting less lysine.
Right.
Yeah.
That makes
Yeah.
sense.
It's a
Okay.
good point.
Cool. Something different to try for sure.
Yeah.
Okay, so another question about skin growth. So this is from Duncan. Duncan says, I was curious about nutrition for skin growth. I've had horrendously thin skin forever, but finally have had decent skin this season. Been taking magnesium and zinc as an experiment this year, but the big confounder is using tip juice or antihydral 3 to 5 times a week regularly. I always used to use a ton, but I've been a bit more diligent this year, so it's hard to say which of these things is making the bigger difference. I'm curious if Madeeha has any thoughts on potential deficiencies contributing to thin skin. Any input?
Yeah. Yeah. I mean, there's like, if I think if you just have a general relatively healthy, balanced diet, you're eating enough protein, getting some vegetables and fruits, and you probably don't have any like mega nutritional deficiencies that would be, like if you have like a nutrient deficiency, you can definitely get rashes and stuff from that. But I think most people and most climbers are not in that category. You're probably getting enough vitamin C, you're probably getting enough B vitamins just through diet. You don't have scurvy, you don't have any other dermatitis that's happening. So I think so long as you're just, you know, good enough. I feel like with your nutrition, you're having some whole foods, vegetables, enough protein, you're probably getting enough. Now there are vitamins and minerals, things like magnesium and zinc that we don't get enough in our diet, and so I feel like it's appropriate to supplement with those if you'd like. I would just say that zinc is one of those supplements that if you take zinc long term, you can give yourself like a copper deficiency. So maybe my only thought input there is it's start supplementing with copper if you're also taking zinc on a regular basis, so you don't give yourself a copper deficiency.
Okay.
Um, Vitamin D levels, I think it's just important to make sure things are at least in that normal range and not, on the lower levels. But um, just from like a climbing performance standpoint, I don't think there's like a single vitamin or mineral that you have to like boost up super high, you know. It's just
Okay.
making sure everything is in balance.
Right. Yeah, and I think Duncan makes a really good point here that it's like when things are going well, it becomes really hard to figure out what exact thing you were doing. And I think that applies to all skin management. That's why I think it's so important to consider like the ecosystem and what's going on in order to come up with a good regimen. And that's why I have my bag of tricks that I take to like Joe's Valley or whatever, is because I've failed enough times that I sort of know
Yeah.
what I'm a little bit closer to like what works. Um, but yeah, I guess, magnesium and zinc would be things for other people to at least consider, even if they're not super important. And then just if you give a mouse a
Yeah.
cookie, you're going to wind up taking copper as well, it sounds like. Yeah. And I've had personally good luck with taking magnesium. Like it's a pretty safe and well regarded supplement. It reduces muscle soreness and helps sleep and stuff. So,
I agree. I take it for like the muscle soreness aspect. And so I'm like, I haven't noticed a difference skin wise, but I don't think it's hurting it at least. Yeah.
yeah, totally.
Mhm.
All right. Last question is from Roy. This is a very short question. He says, will you touch on long-term solar exposure risks like keratosis? And I think the implication here is just that climbers tend to spend a lot of time out in the sun. I mean, if you've ever met like a mountain guide, they usually, you can just sort of tell that they've been in the sun a lot. Um, yeah, what is keratosis for those who don't know, and what's the risk there?
Yeah, I love Roy for asking this question because I feel like I had to talk about like sunscreen at some point today, you know. But yeah, so keratosis, he's probably referring to actinic keratoses, which are precancerous, you know, growths that have a small chance of turning into skin cancer. There's other more benign keratoses, but I think he's referring to that. But yeah, I think the two biggest risks, just answering his question for long-term sun exposure, one we all know about is just increased risk for skin cancers and precancers. And then the next risk that people don't really talk about as much is just premature aging. I mean, I know it's like a little bit more of like a cosmetic thing, but it can also be more than cosmetic because all that sun exposure over a period of time can also thin out your skin and just make you a lot more susceptible to just skin tearing, bruising,
Hmm.
you know, just slower wound healing in general. So even if you feel like you don't have a family history of skin cancer or you're a darker complected individual, your risk of just premature aging is going up just being exposed to the sun. And so, you know, the biggest recommendation is just sun protection of some kind, whether it's through sun protective clothing, caps, long sleeves, pants, sun shirts, and then sunscreen. When it comes to sunscreen, the minimum you want to look for is at least SPF 30. But you know, the higher is going to be good too. You got to put on a pretty good amount of sunscreen to actually meet that number that it's like saying that it's going to be.
Hmm.
And then if you're going to be outside for a while, you want to reapply at least every 2 hours as well.
Okay.
So,
Yeah,
yeah.
I've I don't think I've said this on the podcast, but spray on sunscreen is like a lifesaver for sure, because
Yeah.
if you don't want oil all over your skin, and definitely the other people who are climbing on the same things as you don't want you to have oil all over your skin. So
Yeah. Yeah.
some spray on sunscreen and a partner who can spray it on you is like pretty handy for sure.
Yes, yes. I mean, the best type of sunscreen is the ones that you're actually going to wear. So, yeah,
That's
so
true.
I spray on sunscreen or like sun shirts, so you don't have to put on sunscreen in those areas because they often have like
Hmm.
SPF within them. I really like the sunscreen sticks. I don't know if you've seen them, but like for the face, it's like a
Hmm.
stick, and then you just kind of like if you don't care about how you look, some of them are, you know, tinted or a little bit more invisible, but you can just like rub it on and get to like, you know, areas like the nose, I feel like is prone to getting
Yeah.
sunburned. Yeah.
It's funny you mentioned the premature aging thing, because I'm wearing my Look Good Climb Good shirt, and yeah, all I can think is like, you want to look nice, like you don't want to be
Yeah.
all leathery
Yeah.
by the time you're my
Yeah.
age.
I
So
mean, yeah.
use
I,
sunscreen.
I mean, I feel like climbers, you know, like not every climber cares about having wrinkles and things like that, but they are going to care about having thin skin that's more prone to bruising and all of
Totally.
that. So sun exposure over a period of time will lead to thinner skin.
Good
Yeah.
to know. Yeah, I'm glad that we got that in there at the end. Is there anything else, like any other general things like wear sunscreen, that you feel like you're required to say as a dermatologist?
That's like if there's one thing people, I recommend people to use on a daily basis is going to be sunscreen more than
Okay,
anything. Yeah.
good to know. Cool, leaving people with some general advice. Any final thoughts or other topics you feel like we didn't cover related to skincare for climbing?
No, I feel like I touched on most of it too. If you think of anything, let me know. But
Okay.
yeah,
Yeah, we'll see what the reception is, and if lysine takes the climbing community by storm, we can talk about it.
that would be interesting. Maybe we can get like some randomized control trial going.
Yeah, man,
Yeah.
I so appreciate your willingness to do this and your expertise and your patience with all my stupid questions. This was like,
No, your
yeah,
questions were awesome. I feel like it was like a good balance, because you have that experience and then I have like what I know in derm and then you kind of like mold them together. Yeah. Yeah.
yeah, yeah.
I
Hopefully,
mean,
people
yeah.
get some value from it.
Yeah. Hopefully something. I mean, I feel like skincare is like, it's not a one size fits all and it's, you kind of adjust to based on what your needs are and everyone's skin is different. So,
Yeah, totally.
yeah.
I think that's a good point probably to leave people on. Is it's like it's a it's a journey to figure out what works for you, and I even think it's a journey for every project, like stained glass I was talking about. Like I just know I
Yeah,
haven't had the right skin to try that yet.
exactly.
You know, the flapper that I mentioned where I was like rotating on the undercling,
Yeah,
like it's really windy up. It's like up on a bluff and it's really windy up there, and I just know I need to come into that project feeling really hydrated and with really supple
right.
skin. And like
Right.
I kind of just try to remember that, a very, very small portion of my body is in contact with the rock. It's like just millimeters, square millimeters, basically, and then, a little bit of rubber on my shoes. And like, it's not much. You got to take care of those areas of contact. So
You
it's super
do.
important.
You do. Yeah. Yeah. Well,
Cool.
awesome. It was super, super fun speaking to you.
Well, thanks so much for coming on the show. This is awesome. I really appreciate you for doing
Yeah.
this. Thank you.
It was super fun. Thanks for having me, Jesse.